Are supporting Bridger Care, so just a $10 suggested donation to Bridger Care. We provide affordable reproductive sexual health on a sliding scale, which is fantastic. So QR code, it'll be up at the end too, but they've got a bunch of goodies out in front of you. If you want more information on Bridger Care, you can reach out. All right, so obviously you guys are here for the pregnancy, postpartum, and pelvic health lecture that we're giving. My name is Kylie. And I'm Tiffany. I won't have to walk back and forth the whole time, so. So like I said, my name is Kylie. I'm a residency trained orthopedic PT here at Excel, also trained in pelvic health. Really big emphasis on manual therapy and a lot of exercise-based programming just to get my patients back to in the field.
I'm Tiffany. I am also an orthopedic therapist, and I furthered education in pelvic floor, running, vestibular compression. Then I have a almost 2-year-old boy, and I am about to have another one. So I've lived and learned, and I'm just I'm passionate about helping people through pregnancy, postpartum, no matter if it's 6 months from when you have your baby or 16 years, and it doesn't really matter. It all affects our body differently. So.
I'm Emily. I work out at Excel's Manhattan Clinic. So because we're the only clinic in a small town, we run a spectrum of what comes through the door as far as conditions. So pelvic health, pelvic floor is one of the areas I've had some additional training in, and also first-hand experience with two kiddos, and also very passionate about helping other moms and just women get back to activities that need to be.
All right. So just to kind of give an overview about what we are going to go over today. So we'll dive in by starting, what is the pelvic floor? You may have heard the term, but what is it exactly? What is pelvic floor dysfunction? Moving into what are the common signs and symptoms of pelvic floor dysfunction? And then how can physical therapy help pelvic floor dysfunction? We'll then move into exercise in pregnancy and postpartum, body awareness through the changes with pregnancy and postpartum, body mechanics when lifting and carrying a child, car seat, you name it. Oftentimes those are awkward things that you may not have lifted before, especially when your body's in a different state. Good to go over that. And then we'll start going over some exercises that you can do at home. All right, so I thought this little thing was going to go away, but it may not, but that's all right. So what is the pelvic floor? So the pelvic floor is a group of muscles that support bladder, bowel, and sexual function. They kind of act like a little sling in the bottom of the pelvis. They provide postural support, support our pelvic organs. This is a uterus that sits in here. Coordinate with the diaphragm for breathing and pressure management. They can oftentimes be voluntary, so actively activated, or automatically, we don't have to think about it. One of my favorite kind of analogies for how the pelvic floor works is the boat in a dock analogy. So you can think about I'll give you an image here. The pelvic floor muscle, is the water. The pelvic organs are the boat. And then the pelvic ligaments that help support through here are kind of the dock ties. When the water's high, when our pelvic muscles are strong, we can help support that boat, help support the pelvic organs. When the water level starts to go down, when the muscles start to get a little bit weaker, we lose some of that support to the pelvic organs, more stress through those pelvic ligaments, those boat ties, which can then lead to issues such as pelvic organ prolapse, urinary incontinence, etc. One of the really important relationships, like I said before, the diaphragm with the pelvic floor. The diaphragm is kind of the ceiling to the core. So we all know where our diaphragm is. It's a big breathing muscle that lives up here. We can think of the pelvic floor as kind of the floor of that kind of pressure management system. They move up and down together, which is great to help control the pressure of your trunk. On this image here, when we're evaluating the pelvic floor, we're looking at all of the muscles of the pelvic floor. There's some main ones that we focus on that are kind of the main sling of the pelvic floor. This levator ani group
Iliopsoas, pubococcygeus, and puborectalis are these muscles that live here and help us to round all of our openings, the three openings for the women. The urethra, vaginal opening, and the anal canal. We also have this obturator internus, this muscle that lives on the outside of the pelvis. That's this one here. Right here. Another important muscle in just helping support the pelvic floor, but we oftentimes find a lot of trigger points there, which sounds different than maybe a trigger point living in your upper trap, but we can find trigger points in any muscles. Okay, so what is pelvic floor dysfunction? Big picture, pelvic floor dysfunction is a lot of times just the structures, whether it be the ligaments, the muscles, the tendons supporting this area just are not working well, not working as they should. This sometimes can fall into two categories, whether it's weakness or tightness. A lot of times when we have weakness, it can be related to pregnancy, normal age-related changes. As we age, we know our muscles do get a little bit weaker. Things like chronic constipation or straining to urinate or defecate can cause stress to those muscles, cause them to weaken. Things like chronic coughing, if you have something like COPD, asthma, you get a cold and you have that annoying lingering cough for 3 weeks, that can lead to some straining and cause those pelvic floor muscles to weaken. And then things like weightlifting and obesity, again, thinking increased pressure through that area, increased weight can cause those muscles to weaken as well. On the other hand, we can get tightness through the pelvic floor. That does not exclude being weak through the pelvic floor. You can have both. Sometimes they present similarly, sometimes they don't. The causes of tightness, again, we can still have childbirth. You can see that it's on both. Differences biomechanically, if you've got a tight hip, that can lead to tight pelvic floor muscles, and then leading into overuse injuries. And a lot of the times, the nervous system is pretty closely tied to the pelvic floor. A lot of mental health conditions, if you are having kind of a higher regulated nervous system, you can just kind of involuntarily be clenching or holding your pelvic floor. That can lead to some tightness over time. That can lead to pain, difficulties with penetration, that kind of thing. One area that is not as clearly on this page is bowel dysfunction. We hear a lot of urinary dysfunction when we talk about the pelvic floor. The anal opening is right there too. It's the neighbor to the vaginal opening and the urethra. So important things to note as well. It's not always urine, it can be bowel as well. All right, signs and symptoms of pelvic floor dysfunction. One of the biggest ones, leakage of urine. This can be kind of 3 different types. You can have stress incontinence, that cough or sneeze, that stressful event can make you leak urine. We can also have urge incontinence. So say you walk into the bathroom, you're like, oh man, I really gotta pee. Maybe you're not making it all the way and you're having a little bit of that leakage. That can even happen, pull the car into the driveway. That kind of triggering activity can cause leakage of urine as well. Frequency, so increased frequency of straining, increased frequency or straining, urinating, or having a bowel movement. When we urinate, the pelvic floor is actually relaxing to make that happen. So you don't necessarily have to be pushing out your urine. If you feel like you have to, or you're straining unnecessarily for urinating and having a bowel movement, can be something to think about. Am I trying too hard to do this? Pelvic pain. Pelvic pain is a large, broad category that can have many presentations, many different reasons why that's happening. More often than not, we can see pain with penetration, which can be partner, tampon, speculum, your own hand, whatever is happening, or intercourse. So thinking pain with entrance in the vaginal opening can also just be generalized pelvic pain. It doesn't have to be specific to with penetration. It can be just resting pelvic pain.
Moving on to heaviness or palpable bulging. So relating that to pelvic organ prolapse. If you have a sense of heaviness, you don't feel like you're maybe as supported as you want to be through your pelvic floor, or you can see or feel a palpable bulge. That is something where maybe go into the doc, getting it checked out, come in to see us here for some pelvic floor PT. Pelvic organ prolapse is very, very common, especially after pregnancy and childbirth. I don't know the exact statistics, but it's very high. But if that is something that is not returning back to normal, it's something to come see us for. And then lastly, low back and hip pain. Sometimes low back and hip pain can be tricky, and it can present as, oh, I've got pain here, but it can be issues related to the pelvic floor. Same thing with the hip. Other reasons here, so kind of how I went over, hip pain, pain during sex. You were, or are going to be pregnant. All reasons to go see a pelvic floor PT. You've had surgery, whether abdominal or pelvic or hip. And if you're having issues after that, bladder leaks and urgency and frequency. So jumping into what an exam may look like when you're coming in for an appointment. So understandably, this topic of conversation is not super easy to discuss all of the time. We as PTs recognize that and understanding that these vulnerable topics may not come easy. There was a study done on 25,000 women who went and saw their primary care physician. 32% had a pelvic floor disorder of some type. But there was also another study that 40 to 60% of women were not seeking care for those issues. So we're thinking 1 in 3, but people are not speaking up because it's hard to talk about. It's a little bit taboo. Some of these things have been normalized. You have a kid, you leak a little when you laugh, when you jump on a trampoline with your children. It doesn't have to be the case. So just understanding, going into history, detailed understanding of current symptoms, what's going on, how can we help you? I know a lot of times in my first visit, I may not be jumping into the internal exam right away because you have to build trust, you have to build rapport. We're spending that time building the relationship to understand these vulnerable topics. In history too, we'll talk about, pregnancy history, birth history, surgeries, all that good stuff. Of course, moving into orthopedic exam, we need to look at your spine, your core, your hips, range of motion, strength, really getting an understanding of just who you are as a person and with your body. It's really crucial. That's why I love treating pelvic, is because it's so intercorrelated with orthopedic PT as well. It's not just this stuff. It's very heavily orthopedic as well. It's all muscles. They're just in a different place. Oopsie, there a ligament goes. And then, of course, if it is indicated, if there is consent, if both the patient and the PT believe it to be necessary, we'll then move into internal and external palpation, which just means feeling and touching these specific, I'm just going to leave that, specific areas. Strength testing. So we do internal strength testing. It's measuring how strong you are, endurance of the pelvic floor muscles, and then moving into pressure management. So if you cough, what happens? If you try to bear down, what happens? We can visualize movement of these muscles, this area, when you do pelvic floor contractions externally, which is great. Sometimes, especially if the internal stuff sounds scary, which understandably it can be, or maybe you're pregnant and it's not indicated for us to do internal work, we can do plenty external, just visualizing what is happening. One other anatomy area that I didn't go over earlier is this perineal body. It's the opening, the area between the vaginal and the anal opening. This moves up and down when we do pelvic floor contractions. I encourage all of the women to do some exploration with a mirror and kind of get to know your body. You can see that move up and down. So we can do that in an exam. We don't have to feel internally to know what is happening there. But the pelvic floor assessment is a very, very helpful tool. But again, it's not always necessary. If you're not feeling comfy, that's okay, but it can really help us get to the root, understand what we need to do and how to help you. All right, so how can PT help? Pelvic floor dysfunction and treating in the pelvic health realm is very multifactorial. There's lots of things going into it. I would say one of my biggest areas that I spend a lot of time in is education. You got to know what's going on, why this is happening, what you can do to help it. Education is a huge aspect of that. Moving into lifestyle modifications, your diet and lifestyle can greatly affect your symptoms and what's happening. If you're having a ton of urinary frequency and all you're drinking is coffee and Diet Coke, we know those things to be bladder irritants. We can have conversations about that. Again, lifestyle modifications are hard. We deal with it every day as PTs, trying to get people to do their exercises and get people to start moving more. But when it relates to what you eat, how you live your life, that kind of thing, it can be challenging. One tidbit that I really like to hit on in relation to education and lifestyle modifications is what we call just in case peeing. It's called jicking in the pelvic health world. You are leaving the house, going to the mall. The mall's like getting revamped right now. I don't know if people go to the mall, but you're like, oh, I'm just going to pee before I leave the house. Or go to bed. You're like, I'm just going to pee before I go to bed. Not super necessary. We are actually in our kind of system of our bladder here. We are going to the bathroom before we actually have that desire to urinate. That can sometimes increase our frequency. And sometimes folks are like, oh, I'm going pee 20 times a day. Those just in case moments can increase that. So just something to think about. Think about the urge to void. Maybe you don't need to go. And then lastly, tailored exercise programs. So based on what we find during your exam, it might be focusing on hip strength. It might be focusing on deep breathing, yoga poses, relaxation, all tailored to what you need. This goes all the way from isolated pelvic floor contractions to coming out here with the squat rack and doing some loaded squats. So it's a huge, huge spectrum. And I think that's where we come in as, orthopedic PTs with pelvic health training, is we want to carry that all the way to you being able to do what you want to do. And then, of course, modalities and manual therapy. We have many things that we can do to help work on areas such as tight muscles, like that abdominal endurance that I was talking about with pelvic wands, vaginal dilators if you're having issues with penetration, we can help stretch those muscles out. If you're having some weakness, we can use these Kegel weights. This is not isolated to just using these tools. Of course, as manual therapy PTs, we can use our hands for soft tissue techniques and as well as these other internal techniques that we are trained in. Cool.
If anyone is interested in those tools that we go over training on how to use those, but there are also, obviously have to configure all of these supplies. There is a pamphlet out there that is not going
Yeah. These are just the demos. We don't use these in clinic, but we're like, look at this cool thing.
And if at any point anyone has any questions, feel free to raise your hand. We do ask that if you have a question, you keep it kind of general. If you have a really specific one, great opportunity to have an appointment and talk more about that, or you can ask us after if it's, brief. But feel free to raise your hand if you've got questions.
Plenty of time at the end for questions too.
Great. Oh, that's a good point. Thanks. Yeah. All right. So I get to talk about exercise during pregnancy and postpartum. So exercise during pregnancy is recommended. It's the same recommendations that we get for any adult. So 150 minutes a week of moderate intensity exercise 3 times a week is ideal. And the benefits of this is we see reduced maternal weight gain. It reduces our risk of gestational diabetes, gestational hypertension or elevated blood pressure, and postpartum depression. And the research shows pregnant woman who exercises is less likely to have a C-section, especially due to fetal macrosomia, which just means the fetus is larger. There are some things to consider for exercise during pregnancy. So first is just pregnancy risk level. Second is prior activity level. And lastly is symptoms. So we have a really wide spectrum here of pregnant mothers, and it's best to work with your OB, midwife, pelvic floor PT to find a plan that's comfortable for you and is accurate to your presentation if you're pregnant and thinking about exercising. So this is a resource from one of the courses I took on pelvic floor. It just says exercise in pregnancy at the top. And we can think about conditions during pregnancy like a traffic light. So our red light conditions are absolute contraindications, which just means we will not be exercising, is if the pregnant mother has unexplained persistent vaginal bleeding, a ruptured cervix, triplets or more, preeclampsia, which means dangerously high blood pressure in a pregnant woman, placenta previa after 28 weeks. And placenta previa is just the orientation of the placenta where it's lower down in the uterus. And so as baby gets bigger, it just puts more pressure on that and can be a problem. And then if there's uncontrolled gestational diabetes, hypertension, or a thyroid issue, we need that to get taken care of before we're proceeding with exercise. Our yellow lights are things like recurrent pregnancy loss. So there are a lot of things that play into that just psychologically. If the mother has had miscarriages, the research does not say that exercise causes miscarriages, but obviously there's a lot more that goes into that. So we want to be aware of it. Gestational hypertension, so that elevated blood pressure, but it's not uncontrolled. A history of spontaneous preterm birth, which just means baby came earlier, much earlier than they were supposed to in a previous pregnancy. We want to be aware of that. We want to have a yellow light with twins after mom is 28 weeks pregnant. And if mom has a eating disorder or a history of malnutrition or current malnutrition, we want to know about that too. And then the great news is that it's a green light for literally any other circumstance. So no matter if you exercise before pregnancy or not, we still have that green light. So now you had baby. Yay. Let's move on to postpartum exercise guidelines. So there was a new 2025 guideline posted, and overall the results showed that light intensity exercise soon after postpartum, soon after having baby, led to better health outcomes. So light intensity as soon as possible is what we want. Then it showed that we got even more health benefits when moderate to vigorous intensity exercise was resumed when the mom was ready. So that's ideally 120 minutes a week of that moderate to vigorous intensity exercise, which is exercise that's like getting your heart rate up pretty high. You're not able to have a conversation while you're exercising, or it'd be difficult. But everybody is different, right? These do not apply, like we can't just think of this across the board as the same for everybody. So we're going to talk a little bit more about where those differences can show up and how we can adjust. So Kylie already touched on this. We're wanting to look at three different things. So in postpartum, we want to look at if there's any pelvic floor dysfunction, abdominal wall dysfunction, and then any risk factors for dysfunction or injury or what have you. So the pelvic floor dysfunction would be those things Kylie talked about, like incontinence, that urge to go to the bathroom and difficulty waiting to go to the bathroom, heaviness, pressure, bulging, dragging sensation, pain with intercourse, obstructive defecation, or just that straining with PMs, and then ongoing blood loss beyond 8 weeks would also fall into that category. Abdominal wall dysfunction would be things like diastasis rectus abdominis, which we'll talk a little bit more about later. Pendulous abdomen, which just means excessive fat and skin kind of in this abdominal area postpartum. Weak abdominal muscles and low back or pelvic pain. Some risk factors are timing, whether we like it or not. Within those first 3 months postpartum, there tends to be a higher risk for injury or dysfunction. Acute changes as well, like sleep loss, which we know is very prevalent in the newborn days. And other risk factors would be related to a prior history of RED-S, which stands for Relative Energy Deficiency Syndrome, which basically just means that the caloric intake or the fuel going into the system, someone's body, is not enough to keep up with the energy demand. And so we have this imbalance, and that can lead to a lot of other problems. We want to know if that's in the history. Obesity as well. And then Ehlers-Danlos syndrome is another one of these conditions where someone has a lot of mobility, hypermobility, excessive flexibility that can affect some other things as well. So returning to training depends on even more stuff. It just all depends, if you guys haven't picked up on this. The mode of delivery, so whether it's vaginal or C-section, biopsychosocial factors, so literally anything that relates to the person's biology, biological changes, psychology, social situation, things like breastfeeding, whether mom is doing that or not, current sleep and stress, if mom has a support system, all of these things play in so much. And we want to think about what mom's trying to get back to. So what are the load demands? What is the intensity? What's the impact requirement? Sports specificity for what they're trying to get back to. And if mom trained through pregnancy as well. And then nutrition, we want to know if there's a history of disordered eating and current activity tolerance, where we're starting at. So here are some things that we would look at in the clinic when we have a postpartum mom working with us. We would be testing, depending on if mom wants to get back to strength training, like with weights or resistance, bands, things like that, or endurance training, which is more longer duration, lower intensity, like running, jogging, riding a bike, things like that. So for strength training, we would be looking for a certain number of repetitions of some of these exercises here. So a single leg calf raise, single leg bridge, your single leg sit stand, and side lying hip abduction, which is this one right here. So it just hits on a lot of really important muscle groups, and we want to see how that looks in clinic. For endurance training, for endurance athletes, we're going to look at these things to assess load and impact management. So first, just being able to walk 30 minutes without any pelvic symptoms, abdominal symptoms, anything like that, or pain. Next, single leg balance, 30 seconds on each side. A single leg squat, 25 reps on each side. Jogging on the spot for a minute. Forward bounds for 10 reps. Single leg hop in place, 10 each side. And a single leg running man on each side. So we're gradually upping the impact and just seeing how things go from there. So I just love these pictures. I think they're great. And we say, you know, bouncing back is easier with PT just because we help to tailor a really individualized plan for you to overcome, celebrate all that you've done by having a child and coming back, feeling more like yourself, hopefully being stronger than ever. And that's just something we're really passionate about. Tiffany,
you can just tell me when you're ready to change.
Okay, so now we're going to talk about body changes, body awareness, things like that. This applies to pregnancy, postpartum, picking up your grandkids, picking up your dog, your cats, whatever it is. I think having good body mechanics with all of that is really important, and small changes is a big difference. So specifically with pregnancy, you can tell that your center of mass goes out this way a little bit, and then your gravity changes. So that means that your the forces that are transmitted throughout your body with gravity, with all your exercise, all different than when you aren't pregnant because you don't have this load out here. You also have more mobility and laxity in your joints, which is great, which is what you want at the end of your pregnancy. But it is also really hard on your body because all that increased laxity, you don't have quite as much support as you might have had before, which means that with all that laxity, they increase joint pain, low back pain, pelvic pain, and that's one of the many reasons why the modifications and adjustments are recommended pregnancy and postpartum because of these changes, because your body is different. your body's changing, even postpartum, like even at that 8-12 weeks, like your body is still adapting. And even though like it's a relatively short period of time, those 40 weeks of pregnancy, yes, those changes gradually occur. But remember, like it doesn't change back overnight. It takes time. Your body has to get back to where it was before, which is why exercise is great too. Okay, and then the next one, so let's talk about, yes, so this is our little baby today, okay? So when you are just holding or picking up your kid, it's really easy to just hang out here, even with pregnancy, you just hang out here, because it's so much easier. Your body wants to resort to what is the path of least resistance, okay? So being here, but big changes is even just like thinking, okay, instead of having all my weight feeling in the back, in my low back, I'm gonna shift so I feel my weight a little bit more equally distributed throughout my feet, and then standing like kind of stacked shoulders right over your feet instead of back here. Big changes there. Same thing when you're picking up your baby on the side. It's really easy to go to the side, or your grandkid, or your cat, or your dog, or whatever, and you're cooking, right? It's easy to be right here, but just small shifts can make a big difference. And it doesn't have to be all the time, because nobody's perfect. But even just thinking of it and being more aware of it and switching sides, because if you're right-handed, like me, I put my baby on the left all the time, and I need to hold him on the right. And then with bending or flipping over, again, with anything, you want to make sure that you have your kid nice and close to you. So I'm not going to be like, oh, come here, right? Like you want to be as close as you can. You want to keep your shoulders nice and square with you. You don't want to be here, right? Because that's going to change how much load it is throughout your low back, your hips, and joints. So keeping that baby close. The other thing I always like to tell people is staggering your feet. Okay, this is going to reduce the load in your low back and how much control you need in your low back and your pelvis and the pelvic floor. So just that small change of staggering your feet can make a big difference, especially when you're like from here or down and get heavier and heavier. So having that change, like you will notice the difference. You know, it's so much easier for me to stagger it in my grandkid. And then let's go to car seat. So same thing. Couple different options. So something we can carry over here. But again, you're doing that shift where my whole entire rib cage is sitting on this right side or my left side. So moving here a little bit, having a little bit more support, using both hands as you're going up the stairs and down the stairs. Same thing when you're putting them in the car. You know, as you pick them up in that car seat, try and be sideways because the car seat's going to have to go in sideways. And then instead of here and then twisting, because you don't want to keep twisting and loading your body, it's so recovering because you have to care for this baby. And they say, don't look more than 10 pounds, but your car seat will look more than 10 pounds, and your baby's like 8. So try and stay squared with it so that you're already there because you put them in the car seat. Same thing when you're taking them out. You know, grandkids or not. I can be here and I can try and do it, right? Or I can kind of square up a little bit, be more sideways and try and do it as well. And technology's changed a lot too. Like they have those rotational ones, which does make your life a lot easier. Okay, next. So, biggest take-home messages with your body mechanics, okay? Just be aware of how you're positioned, okay? Am I out to the side or here? You pick up your grandkid, your child, your dog, whatever, all day long, thousands of times. So try to do it with good posture and position as much as you can. Nobody's perfect, but if you think about it, if you pick up your kid, even, you know, maybe more than that, but 3 times a day, that's thousands and thousands, that's like over 1,000 times in a year. And that's a lot of different stress and load throughout your body for just even those 3 times. Keeping your baby close. You want to decrease the stress on your low back. Staggering your feet. Trying to keep your shoulders nice and square. Lift with your legs. as I'm sure you guys have all heard before. The other thing too is trying to engage your pelvic floor and your abdominal muscles when you're doing it. Just trying to make it a habit. You know, okay, so I'm going to go pick up something. Okay, instead of just going straight to do it, okay, I'm going to think about, all right, I'm going to bring my belly button towards my spine a little bit, and I'm going to think about lifting my pelvic floor. We'll go over these in a second too. But just having that extra abdominal support is going to take a lot less stress on your body. And then switching sides and positions often. You want to stay active, take care of yourself, and then work on getting stronger. Okay. Next one. All right, so exercises to avoid. With pregnancy, there is a natural separation of your abdominal wall. This increases in space so that it allows for your baby to grow. Postpartum, you should gradually reduce and heal, usually within about 6 to 8 weeks. If you find that you kind of, as PTs, we assess it. You can always ask your doctors about it too. If you find that it's not getting closed down or you're having like weird symptoms or anything, it's good to just come get checked out because we can work on the pressure management system. So with that separation and certain exercises, there increased pressure and forces on the abdominal wall. Due to this separation, it changes the way that your pressure within your entire abdominal cavity is managed, which means that it can worsen the separation and progress into a diastasis recti, and then increase pressure and forces on the pelvic floor, which can lead to pelvic floor dysfunctions, leakage, or frequency, things like that. So let's go back to this picture. Sorry, I forgot to go over those. So with the exercises that we kind of want to avoid, if we don't have good abdominal and pelvic floor control, pull-ups. As you can see in that picture, you can kind of see like a big ridge down the middle of her stomach. So that's called coning. So that means that she doesn't have good pressure management and that separation is happening and that all that pressure is going straight through that abdominal line where that separation occurs. Same with a plank, having good control. And then as you can see, like this is that coning that's happening there. But these exercises, front planks, sit-ups, any exercises with your legs straight out, those things are going to put a lot more pressure on the front of your abdominal wall. So there's a lot of good alternatives to do, and then just being aware of as I'm doing these crunches, am I having that weird little bump right there? Okay, well maybe you should change how you're doing it, because as you keep doing it and repeating it, you're putting more pressure on your pelvic floor as well. Okay, so now we're going to go over exercises that we can all do at home. And this is kind of just like the beginner starter exercises. You can go to the next page as well. So as we're all sitting, so one of the things that I like to tell people to engage your pelvic floor correctly, because a lot of the times it gets a little funky. You don't really want it to be like where you're clenching your butt cheeks, or like if you're trying to hold a fart in, okay? We want it to be a little bit more relaxed in there, and we want it to be really specific to your pelvic floor. So what I like to tell people is I want you to think about, okay, like if you're sitting in the chair, I want you to think about just gently lifting up a blueberry with your vagina. And then the other
Men can do it too. Men can do pelvic floor contractions.
Yes,
I had to teach my roommates that. They're like, I can't do it.
Yes.
You can't.
So you're just gonna gently think about lifting up a blueberry. Accidentally, you're not gonna squish the blueberry. Or you can think about if there's a straw, you can just kind of gently suck through the straw. Okay. Those are kind of like the best cues that you can kind of visualize. So as we're sitting here, okay, I just have to we're gonna do a couple minutes. So as you breathe, a lot of the times too, your breathing plays a huge role in the pelvic floor, as Kylie talked about. They work together. Okay, so as you breathe, so I want you to take a nice deep breath in. And as you breathe out, I want you to think about gently lifting that blueberry off the table. And then relax. And same thing, breathe in. And as you breathe out, gently lift off. A lot of the times that confusion happens. Most people try and do a pelvic floor contraction when they're trying to breathe in. It's actually when you're exhaling that pelvic floor should contract and engage, okay? So that's the first one. The next one I like to have people do, so you're gonna take your hands on your hips, okay? Gotta feel those bony top part of your hips, okay? My other cue that I tell people for this one, so you don't just look funky, is like if somebody's gonna either try and tickle you in the stomach and you're like trying to avoid it, right? Or somebody's gonna like punch in the stomach, that's kind of that motion you're gonna get. You're kind of like bracing and not trying to let them do that. Okay, so with your hands on your hips, I want you to breathe in. And as you breathe out, you're gonna slowly bring your belly button towards your spine. And again, thinking about if somebody's gonna like lightly tap you in the stomach or tickle you, okay? You should feel kind of those muscles on that side kind of poking your fingers right along your hips. And then just relax. And then again, as you breathe in, and then as you breathe out, you should feel those muscles pull in and your belly button towards your spine. Okay? Everybody feel okay with those? Okay. So, and then the next thing that I would have people do is combine those two together. Okay? So you're gonna do so you're gonna breathe in. And as you breathe out, you're going to pull your belly button towards your spine, and you're going to gently lift that blueberry out of the chair. Hold for a second or two, and then just relax. And then as you breathe out, you're going to do the same thing, belly button towards your spine, pelvic floor up. Good. So that would be like kind of my basic start. So this one's a great one for you to just start. This helps you just be aware of your pelvic floor. Be aware of those deep, so it's called your transverse abdominis muscle. So it's a really deep core muscle that travels all the way around here. Really important for anything that you're doing, whether it's you're lifting, you're running, you're exercising, anything like that. And then having that combination with that pelvic floor, you provide so much support right here because you're engaging your breath. So with your diaphragm, your pelvic floor, and then you have support this way. So you have really good pressure management throughout this entire abdominal wall. And then with physical therapy, our progression would be like, okay, let's get those working, hold those for longer, being able to hold those contractions without having them relax or feel like you're coning or disengaging, and then being able to move them dynamically. So with lifting your legs up off the table and then progressing to both legs off of the table, into a bridge, into a bird dog, things like that, and then working into your squats and your deadlifts. But those are good things to be aware of too, is just, okay, lifting up your pelvic floor, engaging your abdominals, whether you're gonna go and bend forward, pick anything up, whether it's your kid, your dog, grandkid, you're gardening, whether you're just picking something off the floor, just making it a habit, because once you keep training that and working it into your day, you're automatically gonna just start doing it. And then you're gonna have, you're gonna get those pelvic floor contractions, you're gonna have good pressure management, and then reduce, your pelvic floor dysfunctions or injuries later.
All right, so we've gone over a ton of things. Just to wrap it up, some local resources. We've gone over Bridger Care, so affordable reproductive sexual health care and education in the community here. They provide birth control, STI screens, annual exams, other services as well. They have a sliding fee scale, which is awesome. Another point that I want to hit on is Savvy Strength. Ellie Thompson is a personal trainer here in town. If you are at the point where you're like, cool, I feel pretty good. I went to PT for my potentially pelvic floor dysfunction after I have a kid. She provides a 5-week class for postpartum strength and core. The next program is starting early September. I've had friends go to this program post having babies, and they've really loved it. Her website's there. She's got some flyers out in the front too if you're interested. But if you are ready to start PT, regardless of your age, regardless of if you've had a kid or not, pregnancy, postpartum, or if you are just having pelvic floor dysfunction unrelated to any of that, come see us. Even if you want to just start the conversation, if you are curious, you say, hey, I think I might have these symptoms. I'm not sure. What do I do now? Again, that first visit is just getting to know you, getting to know what's going on and how we can help. So like Emily said, she is out in the Manhattan clinic. Tiff and I are at the Bozeman clinic here. So website, phone numbers, you can grab a card on the way out if you're interested in scheduling. We'd love to have you. All right, we'll bring that back up at the end, but want to open it up to any questions. Like Emily said, if you've got pretty specific stuff you're curious about for yourself, we'll hold that for an appointment. But if you have general questions, please ask. So doctor's referral, that will depend on your insurance. Oftentimes, Medicare, we for sure need a doctor's referral. Other insurances, that will be just a quick ask maybe to Jenny or Nicole at the front, or a call in to just, hey, do you take my insurance? We take a good amount of insurances here. So there's always a cash pay option, but if we can take your insurance, we'd love to.
Remember, no excessive speaking. Yes. No excessive coffee, packaging, things like that. And then, just get your pelvic floor, try and change positions, try not to do the same thing over and over every single time. Because that happens a lot. People are like, oh, my back hurts, and I just went to take off my shoe. Well, how many times do you do it a day, and how often do you do it poorly, right? Because even being aware of it, engaging your pelvic floor and your abdominal cavity.
Yeah, and I think that opens it up to, whether or not you are pregnant postpartum or just curious about your body. If you're having any issues with your core, that can relate to pelvic floor as well. If you're like, hey, I just want my core to be stronger, that's a reason to come to PT too. So it doesn't have to be that you have these big issues. If you want to work on stuff, that can be important reasons to come to physical therapy as well. We as PTs, we want to allow you to be your best self. Doesn't mean you need to get hurt to come see us, or if you have an issue to come see us. So just want to put that out there. Yes.
We recommend wait 6 weeks postpartum before coming in, or?
Yeah, so the question was, do we typically wait the 6 weeks postpartum to come in? You don't have to. Emily just had a patient 2 weeks post C-section. So that can be a conversation with your doctor. And like these guys went over your specific case postpartum, but it could just be a conversation, which is great.
It's really just that we won't do any internal examination
Exactly.
within that 6 weeks.
Correct.
But to be honest, the postpartum guidelines are pretty outdated and they're very generalized and not very specific to people's lifestyles. And so I think having good, lots of education and being aware, that can change. Instead of they saying this long, maybe you don't have to because you've been doing this and you have really good pelvic floor contractions if you're not having any of those things. So it's all very individualized as well. But those recommendations are very broad.
Yeah, if you're curious, we would never do anything that would put you in danger. So we have education related to when we can start this.
Yeah. I was curious about how we can support mindfulness, like a mindfulness aspect. Is that under education? If someone's issue is more like a lot of stuff going on in their head, does that also work?
Absolutely, yeah. So the question was related to mindfulness, feeling like a lot of these issues are in your head. So that's a huge aspect of how I think the pelvic floor is bringing in mindfulness practices, whether it be meditation, referral out to a mental health practitioner. That's a big one. But yes, it is within education. It is an exercise that I'm prescribing to go do your diaphragmatic breathing at night. Sometimes we need to down train that pelvic floor. Absolutely. And especially even in postpartum and pregnancy cases, there's a lot going on. Your body's changing. Getting to know your new self could be stressful, cause anxiety. So absolutely, for all cases. Yeah. Great question.
And outside of pelvic floor too. You use that with orthopedic conditions.
Yeah.
Possibly.
Any orthopedic condition, any patient coming in, if you are missing that, you're missing a big aspect. Yeah. Cool. Anything else?
So with the blood piece,
like I mean, almost 20 weeks pregnant, and I already feel like trying to, I don't do strict pull-ups, but like I can feel that my core is just like not as useful. So do I just skip them entirely or just expand it?
Yeah, so it really just depends. I mean, you can look and see if you're growing, because I feel like that same thing, like, okay, early pregnancy, not so bad, you don't have, you know, this my baby on, like, I don't have pretty good control, and then all of a sudden it's like, ooh, like, this is
I
really
feel like I have no before.
Yeah, so to be honest, I usually tell people to kind of skip them because there's so many better other exercises that you can do. Yes, like love, they're awesome. It's great to get back into it, but you know, you can still do a lot of things like that pull downs and things like that that aren't gonna have quite as much pressure on your abdominal wall and cavity. And I also feel like sometimes with pregnancy and you're doing those exercises, like you get like a belly soreness that you're like, okay, something was a little funky because maybe I did something too hard or too. So I think it's really important to make sure you're engaging with your routine or having that good control and just being really aware of it with all of your exercises that you're doing, whether it's, you know, squatting, deadlifting, all of those things. But yeah, I mean, for me personally, like I was like, okay, I'm gonna, now that I felt that way, I substituted doing more like a flat fold down and things like that and rows that aren't gonna have quite as much pressure. Just because it does put more pressure on your pelvic floor, and then it can also increase that diastasis recti, and you want that to be able to heal, and you want it to kind of just gradually increase without having so many external factors that are progressing it as well.
I think too,